Hi all. Today we will see some of the repeated questions of allied health sciences uh, and for nursing students for anatomy. Let's see chapter wise. Nerves and vessels of limbs. Brachial plexus. As a short answer. A short essay. Brachial plexus is a group of nerves which can be seen in the axillary region. And you need to explain the formation of brachial plexus. And you need to write about the branches and the clinical aspects of it. Sacral plexus is formed in the sacral region by the sacral spinal nerves. You need to mention the branches of it. Radial artery is a branch of brachial artery. You need to mention about the coarse branches of it. Blood vessels of lower limb. Here you need to uh, shortly write these vessels of the lower limb. So you need to mention about the femoral artery and the femoral vein tributaries. Short answers are name two nerves of brachial plexus. So you need to mention any nerves like ulnar nerve, median nerve, anything. Here the second question is median nerve. Here you need to mention about the formation of median nerve and the branches of median nerve like anterior trochleus nerve, which muscle it supplies. Ulnar nerve again. The formation of ulnar nerve, what is the root value of ulnar nerve, where it supplies, which muscles it supplies. The radial nerve again you need to mention about the formation of it. What are the roots, nerve roots which is forming the radial nerve, branches of radial nerve, which muscle it supplies. Superficial palmar arch, which is a which is an arterial arcade that is formed in the palm. You need to mention about the branches of it. Cephalic vein is seen on the lateral side of the forearm. So you need to mention about the formation of it, the dorsal venous arch, and so on. Great saphenous vein. Great saphenous vein. There is spelling mistake here. Great saphenous vein is a large vein which is seen in the lower limb, superficial vein. Again, you need to mention about the dorsal venous arch there and where it is draining. It is draining into the femoral vein. Small saphenous vein. You need to mention about again from the lateral aspect of the dorsal venous arch. You have the small saphenous vein which is draining into popliteal vein. The next chapter is axial skeleton and their joints. The short essay would be mandible. You need to write the parts of mandible, what are the muscle attached to the mandible, the different foramina in this, and so on. Parts of typical vertebra. Here you need to mention about the body of the vertebra and the vertebral arch, and you need to explain the body, the shape of the body, and the vertebral canal that is between the vertebral body and the neural arch or the vertebral arch. We need to mention about different processes of the vertebra. So, and there are some features of the typical vertebra. Okay, there are typical vertebrae in each segments that you need to mention. Intervertebral disc, where you need to mention about the two parts of intervertebral disc, the nucleus pulposus and the disc that you can see that the center part is nucleus pulposus and the peripheral part is annulus fibrosus, right? So you need to mention about that. First cervical vertebra, that is atlas. Here you need to mention about the different properties of the atlas, the peculiarities of the first cervical vertebra, why it is called atlas, and what is the function of atlas, what is the joint which is formed by it. Second cervical vertebra, that is axis. Here you need to mention about the parts of axis like dens, right, and the other joints which is formed by it. Sternum, again you need to mention about different parts of the sternum like manubrium, body, and the xiphoid process of the sternum, some muscles attached to the sternum. Name any four cranial bones. So here anything you can mention like frontal bone, zygomatic bone, sphenoid bone, right? You can mention about the parietal bone, right? So anything. Name bones forming the thoracic cage. So here you need to mention about the bones like sternum, the ribs, the vertebrae, right? Foramen Magnum, which is a foramen which is seen in the base of the skull, which is the largest foramen. The structures passing through the foramen magnum. Sellaturcica or hypophyseal fossa. This is a fossa which is formed in the sphenoid bone, where you need to mention the pituitary gland is located in the sphenoid bone in the hypophyseal fossa, right? Coming to the next chapter, muscles of thorax and abdomen, head and neck region. Here diaphragm, short as a diaphragm, you need to mention about the muscle diaphragm, thoracoabdominal diaphragm. So here you need to mention about the origin, insertion of the diaphragm. Origin is from different parts, and insertion to the central tendon. You need to mention about the different foramina, the nerve supply of diaphragm, action of the diaphragm. It is one of the main respiratory muscle, right? Inguinal canal. You need to mention about the inguinal canal's boundaries, anterior wall, posterior wall, floor, and so on. You need to mention about the superficial inguinal ring, deep inguinal ring, the structures passing through the inguinal canal. Scalp. Here you need to mention about the different layers of the scalp, the clinical aspects of each layer. If you write, it will be better. And the dangerous layer of the scalp, that is fourth layer. You need to mention more about that, right? Because it is a dangerous layer because you have emissary veins in that. So you need to mention about that. Respiratory tract, upper respiratory tract, nasal cavity. Here you will mention about the nasal cavity formation, the bonds which are responsible for it, and the different areas of the nasal cavity. Nasal cavity has got different walls, medial wall, lateral wall. So you need to mention about little bit regarding the medial wall, lateral wall. Lateral wall, there are openings of different sinuses. You need to mention where it is opening. Just a rough idea. You have to mention roughly, isn't it? Yeah. Coming to the next chapter, I'm sorry, next question, paranasal air senses. Here you will mention about different air senses in the skull region. You have frontal air senses, maxillary air senses, ethmoid air senses, sphenoid air senses, where it opens. Vocal cords, vocal fold. Here again you will mention about the formation of the vocal fold, the muscle which is there, the vocal fold, and so on. Name muscles of the larynx. There are different muscles in the larynx, paid and unpaid muscles, and intrinsic and extrinsic muscle of the larynx. So you need to mention about all those things, like muscles like vocalis, arytenoids. You need to mention about all those things, transverse arytenoid, and so on. Carina. Carina is a part that is seen in the larynx region, so that also you need to mention. Next chapter is lung and pleura. Here the name the parts of respiratory system and describe the lungs. So here you can mention about the different parts of the respiratory system, starting from nose, nasopharynx, oropharynx, laryngopharynx, trachea, and so on. Okay. Lungs. You need to mention about the lungs, the different features of the lungs, the right and left lung. What are the differences between right and left lung? What is hilum of the lung? What is inside the lung? Some structure of lung can also be mentioned. Shortest is pleura. So pleura, you will mention about parietal pleura, visceral pleura. You will mention about pleural cavity. What are the types of different parietal pleura that we have, and so on. Nerve supply, blood supply. Mediastinal surface of hilum. Yeah, this is regarding the hilum. Hilum of right and left lung is different. So you need to mention particularly what are the difference between right lung hilum and left lung hilum. What are the structures in the hilum? Short answers, pleura. Again, pleura is a question which is repeated here. So you need to mention about the parietal and visceral pleura, the nerve supply, and so on. Mediastinal surface of hilum. This repeated question. Bronchopulmonary segments. Here you need to mention about right and left bronchopulmonary segments separately. You need to define what is bronchopulmonary segments. It is the area of the lung which can be surgically removed, and so it has got clinical aspects also. Microscopic structure of lungs. Here you will mention about the different bronchi, bronchioles, respiratory bronchioles. You'll mention about alveolar duct, alveoli, and inside the alveoli, the different cells in the alveoli, pneumocytes 1, pneumocytes 2, and blood-brain barrier, and so on. Next is heart and pericardium. Here you will mention about the first question is gross anatomy of heart. You need to mention about the different chambers of the heart. First of all, the surface of the heart, different chambers of the heart, and the major blood vessels which are arising from the heart, blood supply of the heart, nerve supply of the heart, right? Clinical aspects, so on. Shortest is right atrium. Here you will mention about the right atrium. Right atrium has got two parts: rough anterior part and smooth posterior part. Then there's the interatrial septum. So you need to mention about features of each part. Tricuspid valve, which is a valve which is between the right atrium and the right ventricle. So again, you mention about the different cusp here, precusp, and how the cusps are attached to the ventricular wall by the papillary muscles, and so on. What's the function of it? Okay, what will happen if it is not functioning, right? Left atrioventricular mitral valve. So that is the valve between the left atrium and the left ventricle. It's called bicuspid valve. Here you will mention about different cusp that is attached to this and why it is called bicuspid valve. So short answers. Pericardium. Here you can mention about the different pericardia, that is fibrous pericardium and the serous pericardium, and the pericardial cavity, the clinical aspects of it. Gross anatomy of the heart. Again, this is the repeated questions. You need to mention about nerve supply, blood supply of the heart, particularly, right? And the different chambers of the heart, the structure of the heart, name veins of the right atrium. So different veins that is draining into the right atrium, like coronary sinus, right? Coronary sinus that is draining into right atrium. In order to that, we have superior vena cava, inferior vena cava, and so on. So here inferior vena cava is asked separately. So here you need to mention about the opening of inferior vena cava, where it opens in the right atrium. There's a valve called eustachian valve, and there are different tributaries that is draining into the inferior vena cava. Mention about that. Superior vena cava, again, there is draining into right atrium onto the posterior surface of the or smooth part of the right atrium. And here you will also mention different tributaries. The formation of the superior vena cava, right? The left and right brachiocephalic veins join to form superior vena cava, and other tributaries, azygos veins, are draining into superior vena cava. You can mention all those things. Coronary sinus. Coronary sinus is the largest vein of the heart, which is draining the heart mainly. There are different tributaries which are draining into the coronary sinus, like great cardiac vein, small cardiac vein, oblique vein of left atrium, and so on. So mention about all those things. Blood vessels of thorax and abdomen, head neck region. Here you can mention the first question is branches of arch of aorta. So here write the branches of it, right? From right to left you have the brachiocephalic trunk, left common carotid artery, left subclavian artery, right? So mention about all those things. Sometimes there are arteries called thyroidia ema, which supplies the thyroid gland. It occurs sometimes, it happens sometimes. Blood vessels of small intestine. Here you need to mention about what are the blood supply to the small intestine. You need to know from where the small intestine has developed, and the blood supply, like superior mesenteric artery, inferior part of inferior mesenteric artery, they supply the small intestine. So you need to, I think it is probably the superior mesenteric artery which is supplying the small intestine, right? Because it is derived from the midgut mainly. Yeah, so you can write about that. Portal vein. Portal vein is formed by the joining of superior mesenteric vein and the splenic vein behind the pancreas, the neck of the pancreas. Then it drains into the liver. So there are different tributaries of it. Mention about that. Name the branches and branches of external carotid artery. There are a lot of branches of external carotid artery. External carotid artery is a branch of common carotid artery. Then there are different branches, like branches are given at different levels, and there some of the branches are arise. So name the branches of external carotid artery, where you will mention different branches of external carotid artery which is arising from the anterior aspect, posterior aspect, medial aspect of external carotid artery. Then you can explain, you can name the branches of it, like superior thyroid artery, ascending pharyngeal artery, occipital artery, posterior auricular artery. The terminal branches like superficial temporal artery, maxillary artery, right? Commencement and termination of thoracic duct. So the thoracic duct starts from cisterna chyli. It ascends upwards, piercing the diaphragm. It runs in the posterior aspect of the thoracic wall, then drains into the junction between the subclavian vein, left subclavian vein, and left interjugular vein. So you have to mention about all those things in detail. Short answers: branches of abdominal aorta. Here again, the abdominal aorta has got branches like anterior branches, lateral branches, posterior branches, terminal branches. Right? There are branches like lateral branches like renal artery, the inferior like there are suprarenal arteries, it is inferior phrenic artery, suprarenal arteries. Then you have the gonadal arteries. The terminal branches are common iliac arteries, lumbar arteries, right? so on. Blood vessels of large intestine. It is large intestine, so the branches like branches of inferior mesenteric artery mainly supplies it, right, and also the superior mesenteric artery. Different branches. Commencement and termination of thoracic duct. This is repeated one. Gastrointestinal tract. Describe the tongue. So here you can mention about the tongue form, the how the tongue is formed, the muscles of the tongue, the different surface of the tongue, different parts of tongue like root, tip, like body of the tongue, different papillae of the tongue. You can also mention about the nerve supply, the blood supply of the tongue, uh, actions of different muscles, right? Yeah. Short answers. Tongue again is asked. Pharynx, mention about pharynx, the formation of the pharynx, the different layers of the pharynx, the muscles of the pharynx, the nerve supply, the blood supply of the pharynx. Some of the clinical aspects which are related to the pharynx also can be mentioned. Esophagus, the length of the esophagus, the extent of the esophagus, the constrictions of the esophagus, the relations of the esophagus, nerve supply, blood supply of it. Short answers. Different papillae of the tongue, like there are different papillae, right? Circumvallate papillae, you have fungiform papillae, filiform papillae, foliate papillae. Mention about all those things, right? And mention about the taste buds, on which papillae taste buds are not seen, right? So filiform papillae does not have taste buds, so mention about all those things. Muscles of the tongue, extrinsic muscles are there, intrinsic muscles are muscles of the tongue. Extrinsic muscles nerve supply, intrinsic muscles nerve supply, actions of the muscles, which muscle is known as the safety muscle of the tongue. Explain all those things. Stomach and intestine. Describe the stomach. The stomach, the capacity of the stomach, the different parts of the stomach, lymphatic drainage, blood supply, nerve supply of the stomach, interior of the stomach, the muscles of the stomach, right? And describe rectum and anal canal. So here both are big topics, so they may not ask like this. They may ask rectum separately or anal canal separately, but if they ask like this two together, then you need to cut short the answers, because it is a big topic. Rectum, here you can mention about the rectum extension, from where to where the rectum is extended, and the relations of the rectum, the nerve supply, blood supply of the rectum, the curvature of the rectum, the supports of the rectum. Similarly, anal canal, the extent of the anal canal, the nerve supply, blood supply, lymphatic drainage of the anal canal, the interior of the anal canal, the sphincters, anal sphincters, internal anal sphincter, external anal sphincter, and so on. Short essays. Mesentery. Mesentery is a part of peritoneum. It's a fold of peritoneum that is holding the small intestine. So you need to mention about the two attachments of mesentery onto the posterior abdominal wall, onto the intestine, right? And what it contains. Stomach. So it's a repeated question. Stomach. Relations of the stomach. Yeah, this is also very important. The anterior relation, posterior relation. Posterior relation of the stomach. It is called stomach bed. There are some structures there. Duodenum, the extent of the duodenum, the length of the duodenum, the parts of duodenum, relations of the duodenum, interior of the duodenum, blood supply, nerve supply, right? Difference between large intestine and small intestine. Yeah, it should be better to write it as a tabulated form, the table, where you can mention the length of the large intestine, small intestine, and different features that can be read. Okay, vermiform appendix. The appendix, define what is appendix. It's part of large intestine. The different positions of the appendix, right, and the blood supply, nerve supply of it, the peritoneum which is attached to the appendix, right. Greater omentum. So here you need to mention about the greater omentum. Here it is. It's a part of peritoneum, right, which looks like a apron, right. It's extending from the greater curvature of the stomach and descending down, and it is forming an apron-like structure. It has 4 layers attached to the transverse column, right. Mention about all those things. Arterial supply of the stomach, So it is mainly by the celiac trunk, the divisions of celiac trunk, the branches, left gastric artery, right gastric artery, right, and they supply, the splenic artery also supplies the stomach. The blood supply of the stomach, mention the supply on the lesser curvature and the greater curvature which vessels are supplying. Okay. Pious patches are the lymphatic nodule which is seen especially in the ileum region, right? Features of large intestine. So you need to mention about three features of the cardinal features of the large intestine, like it has tinea coli, it has sac-like appearance, right? The lumen is larger, and appendix epiploica, right? Parts of large intestine. So here you will mention about the beginning of the large intestine, that is cecum. It has a projection, that is appendix, ascending colon, transverse colon, descending colon, sigmoid colon, rectum. Okay, right. So that you can mention. Anal canal also, right? Glands of large intestine. I'm sorry, glands of digestive system. Mention about the liver. So it's a long essay. Here you need to mention the liver location, which quadrants it is located, quadrant of the abdomen it is located. What are the lobes of liver? Functional lobe, anatomical lobe, the peritoneum attached to the liver, right? The blood supply, nerve supply of the liver, histology of the liver can be explained here. Mention about the portal vein also, the porta hepatis as well, right? Yeah, the relations of the liver, the visceral relations of the liver. Pancreas, again the location of the pancreas, the uh, the exocrine part, the endocrine part of the pancreas, the duct of the pancreas, the different parts of the pancreas, head, neck, body, tail, the relations of the pancreas, the peritoneal attachment of the pancreas, the visceral relation of the pancreas, right? Yeah, those things here to mention. Salivary glands. Here you will mention about different salivary glands like parotid, submandibular, sublingual salivary glands, and you can mention shortly the location of each glands, the duct of each gland, where it is opening, especially the parotid gland where it is opening, and mumps which is related to the parotid gland. So please mention about that also. And yeah, some of the clinical aspects like calculi formation in the salivary gland can be mentioned. Parotid salivary gland, here the question is very specific, parotid. So here you need to mention about the location of the parotid gland, what are the structures inside the parotid gland, like the retromandibular vein, the external carotid artery, the facial nerve, right? And the duct of parotid gland, where it is opening, what are the structures pierced by parotid duct, like gallbladder. Here mentioned about the gallbladder, the parts of gallbladder, the location of the gallbladder, peritoneal relation of the gallbladder, and the continuation of the cystic duct from the gallbladder, function of gallbladder, like structure of gallbladder. Liver external features, here you will mention about the different surfaces of the liver, borders of the liver, weight of the liver, location, peritoneal relation, and the visceral relations. Pancreas already mentioned. The enzymes which are produced with the pancreas also could be mentioned here. Spleen, location of the spleen, the relations of the spleen. The relations means peritoneal relation of the spleen, the visceral relation of the spleen, right? Nerve supply, blood supply. That will be enough to explain all these things. The location of it, right? That also has to be mentioned properly. And next would be yeah, we will continue with the next class.